Welcome to More Living with Jim Brogan, your source of information for living the best years of your life your way. For more than a decade, host Jim Brogan and his expert guests have come together each week to share important news and advice that can impact the lives and well-being of those who are retired and those nearing retirement. Learn about issues like health and fitness, financial planning, social security benefits, investment advice, and more. And now, here's the host of More Living, Jim Brogan.
Good morning, East Tennessee, and welcome to More Living with Jim Brogan, where it's all about living the best years of your life your way. You're listening to News Talk 98.7 WOKI, and in our first segment today, we're going to talk about the coronavirus, COVID-19. Cases are increasing by the day. But what do we believe here? I mean, there's some that are saying, and the media is sensationalizing a lot of stuff, and there's some that are saying this is going to be just an absolutely horrific thing. Others are saying, it's the flu. It's kind of like another strand of the flu. I'd like to get to the bottom of that. We are privileged to have join us Congressman Phil Rowe from the 1st District of Upper East Tennessee. Good morning, Dr. Rowe. Thank you for joining us.
Good morning, Jim. Thanks for having me on.
It's so great to have you with us again. So there's so much information out there, Congressman Rowe, some sensational about how bad this pandemic could be, some of it not so bad. Can you just give your overall view of what you see with coronavirus and what we need to be thinking about?
Yeah, Jim, let me back up about 6 or 7 weeks. And the virus first showed itself. And the coronavirus is a family of viruses. The cold is SARS epidemic that we had 16, 17 years ago was a coronavirus. MERS, the Middle Eastern Respiratory Syndrome, was a coronavirus. So this is a virus that typically is an animal-to-human transfer, and it can mutate and change. And that's what's happened here, apparently. It was, and it looked like it started in the Hubei province in China. Wuhan is the biggest city in Hubei. And the Chinese were very closed-mouthed about what happened there in the beginning. They didn't really realize it until they realized something was going on. We were, I guess, about 6 weeks ago now, the CDC, the Health and Human Services, State Department, Homeland Security, and Health and NIH all came together and gave us our first briefing. We've had weekly to 2 to 3 times weekly briefings since then with those individuals and at the top level. And so what we found out is that this is a virus that's contagious. It's like influenza. We have influenza every year in this country, and that's why you hear in early September, you start seeing these public service ads about getting your flu vaccine. Well, this particular one doesn't have a vaccine, and the best we can determine from the data that we've gotten out of China so far is that really if you're a young person, if you're a child, even though some children have tested positive, there have been no deaths whatsoever. And so the older you get, the mortality rate goes up. For seasonal flu, for all cases, it's about 0.1%. And you see varying numbers, and the reason you see varying numbers is the following. How many people have actually been tested? There are a lot of people who walk around who are totally asymptomatic that have this virus. So they don't have any symptoms at all. And I'm going to give you some examples in just a minute of people who live in our district, the 1st Congressional District here, that have been through that. So the more people you test and find out that are positive, the death rate, the percentages you see will go down. So for young people, it's very low. If you can believe the data out of China, if you're above 80 and have comorbid, meaning other health issues like lung disease, chronic obstructive pulmonary disease, or you've had cancer, you've been treated with chemotherapy, then that's about 15%. So the older you get, the more likely it is to happen. Now, we had an experiment about a month ago in the Diamond Princess, and there's a ship now just off the coast of California that's having a similar experience, and we've learned from that. I happen to know some people that were on that ship, and so I contacted them and talked to them, and I've had contact with one of the people just yesterday who is still in Japan. It was an employee on the ship. He was an entertainer, and on the ship, the person I talked to, we realized immediately that you can't isolate people with health service people. I mean, with food service workers on a ship. They're food service workers, and they're not, and they're ship's mates. They're not healthcare people. So we needed to get people off and isolated, and that has happened. And those that have done that have done very well. One person is still in that I know that I talked to just yesterday, still in Japan, in sort of a semi-isolation situation. So ultimately, we'll see how this is. Fortunately, it's hitting the United States late in the year. So I think that's going to tamper a little bit the severity of it, because it's just, you don't typically see flu season in the middle of March get really bad.
So you think
much earlier?
So you think the warmer weather will help with all this?
I do.
You do?
And Jim, people are doing some. I travel a lot, and I mean I'm on 4 airplanes a week. So, and I'm watching people in the airports. People are doing better. They're washing their hands better, covering their mouth. The simple things that we all know to do when you have not traveling. I don't want to hurt the travel industry right now, but I don't believe I would be buying a ticket on a cruise to Southeast Asia right now. I think I'd stay home and go somewhere else.
So what would be your advice? I mean, what should people, I mean, a lot of people you're seeing people stockpile things at their house in case they have to just stay at home for weeks at a time. Do you think that's an overreaction? What should people be doing to protect themselves from the virus?
Yeah, I think the main thing, Jim, and that's that's a decision people make every time it snows an inch. We do this. We empty the grocery stores here. I think that's a little over. I haven't done that, and I'm going to tomorrow morning. I've got to go to an event tonight over in Hancock County, Tennessee. In the morning early, I'm going to get up and get on an airplane, fly back to Washington D.C. for some things. So I'm not changing that. I am changing behavior about how I wash my hands, and if you can stay out of crowds, do that. And having said just that, I'm going to drive over to Asheville here in about an hour and watch East Tennessee State University play basketball. So a lot of people are going on just using common sense things. And let me say something about testing, which is extremely important. And I've got this to we met with the vice president this week, and I emphasized this to him when I talked to him. It's extremely important for doctors like me that see patients every day, that go down to the office. My practice as a walk-in clinic, and they will see a lot of people. It's very important for the practitioners that are in those practices to be able to order a test if a patient comes in and thinks that they might have that. Maybe they've traveled somewhere. Maybe they've come in contact with somebody who's traveled somewhere. Those testing kits are being made available now. We were a little slow to get going on that. But they're going. The Quest Diagnostics and LabCorp, which are 2 large commercial laboratories, are going to start ramping up big time about the testing. So, Jim, if you think your family's sick, you go down to your doctor and they check you for influenza. Well, we need to be able to do that for this particular influenza also.
So would be, your biggest advice would be just people use caution, wash their hands regularly, don't touch their face a lot, be careful in big crowds. What do you think about travel and even flying regionally here in the United States?
Well, that is going to continue. I think. Look, we do that during flu season. Tens of thousands of people die of complications of influenza each year in this country, including this year. Over 100 children have died of influenza complications. So I'm going to continue to travel because I need to for my work and my job. And I think you're going to see people continue to do that. Travel for leisure, I'll give you an example. We were scheduled to go, a group of us were scheduled to fly for the 75th anniversary of the Battle of Iwo Jima. We canceled that trip. And I would encourage people who, if you've had a trip planned to Vietnam or China or Japan, I would think twice about that. Me personally, I wouldn't do it. Right now, I think you just don't do that until this gets resolved a little better. We can figure out exactly. And it looks like that it has peaked in China and is going down. That's a good thing. And that's typically what happens. I don't care whether it's Ebola, which is a hugely lethal virus. Let me say something about treatment. We had a meeting this week, which included the vice president, with pharmaceutical industry and with others. And so what is happening now is that the vaccine is being ramped up at light speed. In 42 days from the time they identified that this coronavirus was there, we already had a vaccine at the FDA for testing, for approval, NIH. So that is happening very quick. It won't be available for probably a year. Secondly, there are already patients that are signed up for studies in China for antivirals. Gilead Pharmaceutical is one that did the hepatitis C. Some of the drugs that are available for HIV, hepatitis C, might work for this novel virus. So they're already being signed up and put in a study to see. And there's also compassionate use for this in people who are very, very ill. So many fronts, and the private sector and the public sector working together on this, and it's good to see. We're all Americans, and it's one of the reasons I wanted to help the people on that particular cruise ship, was that they're all Americans, and we need to take care of it. We don't leave anybody behind.
Absolutely. Well, I'm glad to hear that the ramping up of the testing kits is going to start happening pretty dramatically. That's very, very good news. Congressman Rowe, thank you for taking time out of your busy schedule to phone us in this morning and give us kind of an update of where we are on that. We might circle back around to you in a few weeks. Thank you so much.
Absolutely. Thanks, Jim. Have a great weekend.
Absolutely. You too. That's Congressman Phil Rowe, also a physician here in Tennessee, serves on several health committees. I wanted to get his perspective on coronavirus. Now, when we come back, you know, the addiction to prescription drugs and opioids has really skyrocketed over the past few decades. And so we're going to be joined by the Metropolitan Drug Commission to talk about what local organizations are doing to fight the opioid crisis. So don't go away as you listen to More Living with Jim Brogan here on News Talk 98.7 WOKI.
You are listening to More Living with Jim Brogan. During the week, Jim is a financial advisor, an author and speaker with an MBA from the University of Tennessee, who specializes in helping people in or near retirement plan for the next phase of their lives. You can reach Brogan Financial during the week at 865-862-6800 or on the web at broganfinancial.com. And now, here's Senior Market Advisor Magazine's 2011 National Advisor of the Year and host of More Living, Jim Brogan.
Welcome back to More Living here on News Talk 98.7 WOKI. I'm your host, Jim Brogan. And that was a great first segment with Congressman Phil Rowe talking about coronavirus. If you missed that, we will have that podcast on our website by Monday. You can go to broganfinancial.com and click on radio show, and you can pull up that podcast. We're going to switch gears now. The opioid crisis, as we know, is at epidemic proportions throughout the United States, and especially right here in East Tennessee. Now, drug addiction isn't something new, but addiction to prescription drugs and opioids has really skyrocketed over the past few years. So we have Karen Pershing. She's from the Metropolitan Drug Commission, and she's joined us this morning to dive into the statistics, prevention, and what area organizations are doing to combat this crisis. Good morning, Karen. Welcome to More Living.
Good morning.
It's so great to have you in studio.
It's great to be here.
Yes, ma'am. Thank you. So we hear a lot about opioid addiction and the crisis that we're facing. Can you first just walk us through exactly what are opioids?
Sure. Opioids are pharmaceutical medications used to help with pain management. And so they've been around for a long time. But what happened in the mid-90s is there were a few physicians in the country, just a handful actually, that said that we had an epidemic of untreated pain in this country. And so it really unleashed a whole new way of looking at these medications and applying them with patients. And so you started seeing dramatic increases in how these medications were being used. And then you saw Joint Commission come in, who oversees hospitals, and came up with the smiley face pain scales, sad face, frowny face. The pain scales. Pain is something that is now a vital sign that didn't used to be. And what we know about most vital signs is that they're objectively measured. Pain is not something that has an objective measurement. It's very subjective from one person to the next.
Yes, it is.
So it's very, very hard for medical professionals to gauge someone's actual pain and pain tolerance. And so it just kind of opened Pandora's box. And a lot of folks were prescribed these medications for various post-op surgeries, whether it be any kind of pain. And
then some physicians abused it tremendously, right? And there's been documentaries about them. And
sure, you saw the proliferation of what we call pill mills, which were pain management clinics who were basically just feeding addiction and creating addiction in a lot of communities. And Tennessee, unfortunately, suffered in that area as well. At one time, we had 333 pain management clinics in the state of Tennessee. And when you look at our population, we obviously had a lot of people in pain.
So this really is different than the typical drug addictions of the 70s, 80s, and 90s, right? Because it was kind of pushed out to people through the traditional medical supplies, if you will, or through the medical infrastructure.
Definitely. So people thought they were safe. And, of course, the pharmaceutical industry who is producing these medications were also saying the potential for addiction was extremely low. So they misrepresented that on the front end. And so I think we've learned the hard way that these medications are very addictive, and that people who have a predisposition to addiction already are going to be even more susceptible.
Now, according to the CDC, in 2017, Tennessee providers wrote almost 95 opioid prescriptions for every 100 persons. That was the third highest prescribing rate in the country and 1.5 times greater than the average U.S. rate. What do you think's going on in Tennessee that makes our rate so much higher than the national average?
Well, I think some of it just goes back to our history of addiction. Again, we have, if you go back to
I guess rural Appalachia, there's just more of a history there.
Yes. And, you know, when you look at the particular opioid issue, folks who have addiction issues, who have government benefits, now had access to a powerfully lethal drug that was paid for by their government benefits. So again, the TennCare Medicaid type population too now had access to a drug that could cause addiction and could create a high. So you just had all of those things kind of coming in together. But we also we have to take some responsibility as consumers. We've also overused antibiotics in this part of the country. Mm-hmm. So when we go to the doctor, as consumers, we expect to leave with a prescription or we didn't get our money's worth. And so we have
Which is really not the right mindset.
No, it's not. In fact,
it's like, everyone wants to treat something with a pill all the time.
Right. So some of it is the consumer mentality and the pressure physicians feel to give people what they want so that they'll keep coming back and not switching doctors.
You know, in terms of care and in terms of prevention to the opioids, you know, it is kind of scary. Like, there's been a couple of times in the last 5 or 6 years where I've been prescribed a pain medication coming out of a surgery or something or an injury, and it scares me to death. And I'm like, I may take it for a day or two, and then I'm like trying to immediately get down to an 800 milligram ibuprofen or a Tylenol. You know, I'm wanting to get off it as fast as I can. What would you say to people who have coming out of a surgery or have had an injury? How long does it take for somebody to actually get addicted? I've heard things like 5 days you can get addicted to a painkiller. Well,
actually, there's a difference between physical dependence and addiction. So physical dependency could happen as early as 3 days. And what that means is your body goes through a predictable set of withdrawal symptoms once you remove that medication from your body. So you're gonna feel a mild flu-like symptoms once your body no longer gets that drug, and that can occur as early as 3 days. Addiction is different. Addiction is when it hits the brain and it rewires your brain, and your brain now says, I have to have this drug, and it becomes a very compulsive behavior, and you're going to get that drug regardless of what it costs you, because it becomes the primary focus of your life. So dependence and addiction are two very, very different things, and I think those two get confused when we're talking about it.
So how do we prevent that from happening when we're coming out of a surgery or we have a bad injury? Because the doctors prescribe it for us.
Sure.
And then I've been through that, and I'm like, well, I don't want to, I've taken one for maybe a day and a half, and then I'm like, okay, I'm not taking that anymore.
And you're doing the smart thing, and I would recommend everyone do that. There are screening tools that can identify whether you are more predisposed to developing a substance use disorder that we're encouraging doctors to use on their patients.
Is that a blood test or?
No, actually it's just a questionnaire. Huh. A lot of this we can find out just from asking a few questions about someone's history, about their family history. A lot of times can lead you to whether or not they're going to have more of a propensity towards developing a substance use disorder. But what you're saying is something we should all be doing. Number one, we should be asking, do we need a controlled substance following a medical procedure to begin with? If it's something that wasn't that serious, could we use Tylenol? Could we use an 800 milligram ibuprofen?
Yeah, I like to call it vitamin I.
Right. Vitamin I is a good. So, are there alternative therapies that can be used that are non-narcotic? Sure. And so we need to go that route first.
I think just recognizing, hey, this medicine that I've been prescribed is potentially very dangerous, and so it's a very serious, just a very serious drug, and so it has a benefit, but I've got to be really respected and be very, very careful and cautious with it.
Right.
Maybe it's a good way to look at that.
And what I tell people, too, as far as having these medications around, is you need to treat it as if it's a loaded gun. There's a lot of talk about gun safety, in this country. And to me, these are as powerful. And if they get if a child gets a hold of one of these pills and they're opiate naive, it could be lethal to them. And so we need to treat these medications as if they're potentially a loaded gun. And we need to lock them up if they're in our homes, keep them away from anyone. We need to be counting our medications if we have to take them and make sure there are none that are missing. Because if somebody's going to steal your drugs, they're not going to take the whole thing, because then you're going to know. They're going to take 2 or 3 pills at a time.
Yeah, I think that's a great analogy, thinking of it as a loaded gun. We're visiting with Karen Pershing. She's executive director of the Metropolitan Drug Coalition, and we're discussing the opioid crisis. When we come back, we're going to talk about some myths about opioid addiction, especially with the types of people that can fall prey to this. And we're going to dive a little bit more into what we can be doing to spot problems in people we love. We'll also have our dollars and cents segment. Why this low interest rate environment could be one of the most dangerous things that could happen for people that are retired today, and what do you need to be doing to combat the enemy of low interest rates for today's retirees. So don't go away. This is More Living with Jim Brogan, only on News Talk 98.7 WOKI.
His weekly radio show, television news appearances, and adult education classes taught at the University of Tennessee and Pellissippi State Community College, Jim taps into his extensive knowledge and experience to address issues important to living your best retirement. Join Jim every Saturday morning at 9 a.m. here on News Talk 98.7 WOKI, and visit him online at broganfinancial.com. And now, here's the host of More Living, Jim Brogan.
Welcome back to More Living with Jim Brogan, where it's all about living the best years of your life your way. This is News Talk 98.7 WOKI. We're visiting with Karen Pershing. She's the executive director of the Metropolitan Drug Commission. We're talking about the opioid crisis. Very important topic. Before we get back to Karen, it is time for dollars and cents.
Want to be sure you are getting the most out of your retirement? For all the years of your retirement? That's the primary goal of More Living with Jim Brogan and our Dollars and Cents segment, where we provide you with an important financial tip that will help positively impact the quality of your life in retirement. And now, here's Jim with this week's Dollars and Cents tip.
The danger of low interest rates to today's retirees. If you're retired or getting ready to retire, be very, very aware of the danger of low interest rates. I'm looking at a chart here of the 10-year Treasury. In other words, if you buy a 10-year Treasury bond from the United States government, how much will you earn on that 10-year Treasury? And it's down to 0.767%, under 0.8%. In the last 2 weeks, for the first time in U.S. history, the 10-year Treasury bond is paying less than 1%. Now, there are a lot of ramifications of that, some good, some bad, but here's why it is bad for today's retirees or soon-to-be retirees. When you retire in a low-interest rate environment like that, it makes one asset class that people invest in more and more when they're retired. It makes that one asset class a real danger area. And that asset class is traditional U.S. bonds. You know, bonds and interest rates move in an opposite direction. So if interest rates, they can only do one, they're lower than they've ever been on a 10-year Treasury. So they can either stay low, in which case they're not paying anything, or rates go up, and when rates go up, bonds go down. And when you buy bond mutual funds, you are buying, that mutual fund is buying bonds, and they constantly buy and sell bonds. They're not ever holding those bonds until they mature. And so they're constantly buying and selling. So what happens is when interest rates go up, the bond values are going to plummet. The reason people use bonds in a portfolio is it's a good hedge to volatile stock market conditions like we've had the last 2 weeks. The market's been chaotic. It went down 12% in 1 week. People rushed to the safety of bonds. The average bond mutual fund in America that just buys kind of intermediate term bonds, which typically means around 5 years in length, in duration, okay? Those types of bonds 2 weeks ago made 1%, where the stock market lost 12%. So that's why they're used often in a portfolio as a hedge, because they help hedge risk, because people are rushing to the safety of bonds. The problem with that for retirees today is while that helps you in the short term, that in the long term, when we look out over 10 or 15 years, you're going to be stuck with these real low yielding bond funds. And then if the rates go up, the bond funds are going to do even worse. So you're going to be stuck with an asset that's doomed to failure in your portfolio. Now, don't misunderstand me. That doesn't mean you shouldn't own any traditional bonds or bond funds. It means you have to be very careful with how much of that exposure you have in your portfolio. And then to hedge risk, think about the environment we're in right now. It's like, well, Jim, things are so chaotic in the stock market right now. Oh my gosh, what do I do there? But then we got these bonds that are, the interest rates are just, it never been this low before. So see, it creates a challenge. So the key is, number one, you have a financial plan where you support short-term income needs with investments that are not in the stock market going up and down. So your income needs over the next 5 or 6 years are not tied to the stock market. Now you're not worried about the timing of is this going to turn into the corona bear? Is this going to be a coronavirus bear market? Or is this going to turn out to be a temporary correction? No matter how we look at this, it's still a transitory issue with coronavirus. It's not going to last forever. And then the markets and the economy otherwise has been very healthy. So if if you've got an income plan that allows you to look out 5 or 6 or 7 years, you're not as worried right this minute about what's going on in this chaotic, panic-stricken stock market. Likewise, you've got to be careful how you hedge risk, because traditional bonds are going to be very, very dangerous. So you've got to have a much more diverse investment plan. You've got to have good bond alternatives that can go in the portfolio that can provide some safety and stability, but where you can reasonably expect to beat inflation with your safe and stable holdings. And then you need a financial plan that's going to focus on both short-term needs. You still need long-term growth, and having a heavy bond mix in that long-term growth is probably not going to work out very well. So be very, very wary of the danger of low interest rates for today's retirees, and the need to have a financial plan that addresses this particular risk that's very unique in our U.S. history.
That's our Dollars and Cents segment for this week. You can find this week's Dollars and Cents segment and others by visiting BroganFinancial.com.
Do please check us out at BroganFinancial.com. You can also, I've got 2 more upcoming classes in the spring. Pellissippi State in their Blount County campus is having a class, Thrive Financially in Retirement. It's April the 7th and 14th. If you're out in Blount County, or if you're in West Knoxville, especially in that North Shore area, it's a quick drive out to Blount County. That's April 7th and 14th. You can go to PellissippiRetirementPlanning.com for more information. And then I'll be at the University of Tennessee at their downtown conference center, Financial Survival for Retirement, April 28th and May 5th. 2-part class, 2 2-hour sessions. For that, you can go to FinancialSurvivalForRetirement.com. Or if you want to just see all that, go to BroganFinancial.com, click on classes, and you can find out more information about my classes so you can be equipped to make informed and prudent decisions that can impact the quality of your life in retirement. I cover 7 main topics that I think every retiree needs to know to be able to plan a successful retirement. It is an unbelievably challenging investment world. We've got volatile markets. We've got historically low interest rates. We have also expensive stocks in these volatile markets. It's an extremely challenging environment to plan a retirement. In that class, I want to equip you with the right information to move forward with a financial plan. Not how do you pick an investment? How do you develop a financial plan and invest for specific outcomes so you can be successful in your retirement years? Okay, this morning we're visiting with Karen Pershing. She's executive director of the Metropolitan Drug Commission, and we're talking about the opioid crisis here in America. And, Karen, when you think of drug addicts, you don't normally think of white-collar businessmen, stay-at-home moms, grandparents. What are some myths about opioid addiction?
Well, I think myths in general around people with substance use disorders are the homeless and that perception that we have in our minds that it's those people. And what we know about addiction and about substance use disorders is it can happen to anyone, regardless of your race, your gender, your economic status within a society. The only difference is if someone does have resources, a lot of times they're able to get the help they need when they need it and find a life of recovery. And that's the difference in those who have resources and those who don't.
Absolutely. What are some signs, Karen, to look for if you think someone has become addicted to opioids?
Well, one of the early signs is just the loss of interest in things that were normally important to a person. In families, you'll see individual withdraw from family activities. You'll see, if it's a young person, you'll see a change in friends. A lot of times change in personal hygiene habits, so they don't care as much about personal hygiene. So some of those things, not telling the truth, and having trouble telling the truth when asked point blank about things. And one lie kind of leads to the next lie. So there's a lot of that happens.
All that's, that's kind of similar to what you hear about alcoholism and any other kind of drug abuse is, some of these people withdraw things that were important to them or not anymore. I mean, it's just being aware, right? That we see this changing behavior.
Right. It's a disease that isolates And so, we talk a lot about a particular drug, but really the drug of choice doesn't really matter. The disease of addiction affects people the same way, whether it's methamphetamine, whether it's alcohol, whether it's, opioids. People still have those same general characteristics, and it affects the brain in the same way. And so people can recover. And that's the beautiful part of this, is they don't have to stay in a state of active addiction. They can find treatment and find recovery.
Are there effective treatments and facilities in the area that specialize in opioid addiction?
Sure. There's medication-assisted treatment facilities in our area. There are outpatient clinics that use a therapeutic intervention along with a medication to help ease the symptoms and help quell the cravings that opioids create, in order to keep someone in a process of getting the counseling and the therapy they need over a longer period of time. So there are quite a few of those clinics, and those clinics are now licensed by the state, so they have criteria that they have to meet in order to obtain and maintain that licensure. So there's a list of those. If you go to the Tennessee Red Line, all of those facilities are listed. And then we have, of course, your traditional abstinence-based programs can work for any kind of drug. So whether it's alcohol, opioids. So there's no right or wrong way, Jim, for people to find recovery. And for folks, it could be, very different from one person to the next. Some people have found recovery and have not gone into a traditional treatment program, and they've managed to find it through their faith, through the 12-step recovery programs that are out there in the community. So again, I'm not a person in long-term recovery, and so I try not to judge how people get there. I just want to be supportive of anyone who is seeking that, and help navigate them into the resources that are out there in our community.
Sure. And how our community supports this. Now, there's government support, and then there's a lot of faith-based and community support. So when we come back from our last break, I want to get into the balance of that. Where does the Metropolitan Drug Coalition kind of come in there, and what your thoughts are on sharing resources to help support this crisis. So don't go away. We're visiting with Karen Pershing, Executive Director of the Metropolitan Drug Coalition, right here on More Living with Jim Brogan on News Talk 98.7 WOKI.
Thank you for listening to More Living with Jim Brogan. If you miss any of today's show or want to listen to it again, visit BroganFinancial.com, where you can access the podcast and other educational materials to help you in your journey through retirement. And now, here's Senior Market Advisor Magazine's 2011 National Advisor of the Year and host of More Living, Jim Brogan.
Welcome back to More Living here on News Talk 98.7 WOKI. I'm your host, Jim Brogan, and we're visiting with Karen Pershing. She's the Executive Director of the Metropolitan Drug Coalition, and we're talking about the opioid crisis. Do check out my website at BroganFinancial.com. We will have this radio show podcast by Monday. You can listen if you missed part of the show. In the first segment, I had Congressman Phil Rowe on, who's also a physician, and we talked about coronavirus and his perspective on where we are with that and how bad is it, how dangerous is it, what is it like, all those things. So check that out. You can also subscribe to follow us. You can follow our weekly e-newsletter, e-news blast, where we send you links to our podcasts, our blog postings, so you can just stay informed as things kind of evolve in terms of the rules and financial planning and all of those kinds of things. So do check us out. BroganFinancial.com. Karen Pershing, Executive Director of the Drug Coalition, the Metropolitan Drug Coalition. So, I had Knox County Mayor Glenn Jacobs on the show here just a couple of weeks ago, and we talked about that balance between the government being involved in supporting drug addiction, or the prevention of and cleaning up and reducing drug addiction, but then also the role of nonprofits, faith-based organizations, and that they play a very key role in all of that. What is your perspective on the balance of how our nonprofits work with government?
Well, I think it takes all of us, and including business leaders need to be part of this conversation as well. So, yeah, government, nonprofit, private business, this affects every one of us, and we're all taxpayers. So when you look at incarceration rates right now, and you look at our detention facility, it costs about $75 a day for someone to be sitting in the Knox County Detention Facility. Over 70% of those folks are there due to drug addiction of some sort. So if you could take
it's a big number.
It's a big number. On average, we have about 1,200 inmates per day. So you can do the math, and as Knox County taxpayers, this is what we're paying to incarcerate folks with addictive disease. So if we can prevent the disease of addiction to begin with, it's going to benefit all of us. So we can all play a role in prevention. Business leaders, again, there are things you can do in your business to set a healthy environment for your employees. The way your benefit designs are laid out for your employees can send a message. We've got to train healthcare professionals in screening folks to identify those who may be at risk for addiction and prevent those addictions from occurring. So we're all going to save money, whether it be government, nonprofit, business.
And that's important. It's also
Sure.
It's a humanitarian thing, really.
It is.
I mean,
it is.
So tell us about the Metropolitan Drug Coalition.
Yeah. Well, we have been around for almost 34 years now, and our focus has always been on the primary prevention side, trying to prevent the disease before people get it, which of course is the biggest return. What we've learned though, Jim, in the last 3 to 4 years and through prevention science and research is that this whole idea of ACEs and adverse childhood experiences, and the fact that kids who are exposed to numerous ACEs, adverse childhood experiences, and have high ACE scores have much more propensity for having addiction issues and mental health issues as an adult. So in thinking about this and where we're going with prevention, it makes sense to help people stay in long-term recovery, especially those who are parents, because while they're in active addiction, they're creating adverse childhood experiences for their kids. And so if we can heal those adults in that home and create a safer environment for those kids to grow up in, we're preventing future addictions, because those families are going to heal and those kids are going to do better. And so what MDC is looking at right now is establishing a recovery community center in Knoxville. We know from addiction science it takes anywhere from 12 to 24 months for an addicted brain to heal. Most people get 2 weeks to 30 days of addiction treatment, formal treatment. So they're coming out of treatment and their brains are still not well and healthy.
They may be chemically okay, but they still got to heal the brain.
Yeah, right. They're not using, but they're just starting in the recovery process. And we're sending them out the door and we're saying, you're cured. Good luck.
Yeah.
Well, what we've learned is that this is a chronic disease. And so it's going to be with them all the time, and they're going to need additional supports.
Well, thank you for all that you're doing with the Drug Coalition. That's Karen Pershing, Executive Director of the Metropolitan Drug Coalition. Very, very important work that they're doing in the opioid crisis. Today on More Living, we've discussed the opioid crisis because a greater community provides for more living so you can live the best years of your life your way. Thank you for tuning in. This is More Living with Jim Brogan on News Talk 98.7 WOKI. Have a blessed weekend.
The views expressed by Jim Brogan and his guests are not that of Cumulus Media. Any discussion of financial, legal, and tax planning strategies is not intended to be individualized advice and is general in nature. Always consult with your advisor for advice specific to your needs. This program's content does not represent a recommendation of any particular security, strategy, or investment by Jim Brogan or Brogan Financial Incorporated.